Hello, friends. One day we're going to convene here and it's going to be wonderful news. It will probably be the day when I get to rule the world and, I can make all the decisions and that will be a good day. Until then, we're going to keep meeting and discussing things that are making me a little bit grumpy inside and are affecting the world that I think everyone should know about. Today, we're going to be talking about how a level 1 trauma center in Atlanta is closing, or at least that they say they're closing. And I'm hopeful, as if this one YouTube video is going to change their minds. They're going to be like, well, we saw Liz's video and we've thought carefully about it. Vanessa, Cal, and Chad also had good points. So we won't be closing anymore. We can dream. We're going to be talking about Atlanta Medical Center closing. It is owned by Wellstar. And we're going to talk about the implications of what it would mean if they did close, why kind of they are closing. We're going to touch on Medicaid expansion and how that kind of plays into it because Georgia does not have Medicaid expansion, and what the population, who this would affect the most. And all the things going forward. Questions, comments, concern, always leave in the chat. If you guys live in the area, if you have extra insight, that would be a delight. If you have other concerns, let us know. If you're watching live, hello, welcome. Do let us know what, is it a good day? Is it a bad day? Where are we? I will tell you a brief story. That's my child knocking on my door, so we will ignore her for the moment. Avery, darling, I'm a little busy. How has your day been? Mine was going okay. And then I had a weird interaction at lunch that I will tell you about. And then we will dive in just a moment. All right. Thanks for being here, friends. If you're watching on the replay, there will be timestamps. Let's dive into things. I need to text someone to come and grab my dear child. Hello, friends. Would you like to introduce yourselves really quickly while I acquired someone to come and help me with my offspring?
Hi, everyone. I'm Vanessa, aka Mama Nurse. I'm a trauma surgical ICU nurse, and I have some strong feelings about this today.
Hi, everyone. I am Mr. Midwife, aka Chad, Mr. Midwife. I've just built out the channel. I don't have any content yet. I will take suggestions by all means. Anyway, I am a practicing midwife in the U.S. Southwest, and I got some thoughts of my own. Liz, I got 6 kids. I get this. Go take care of your daughter. I understand it.
We have our wonderful nanny is here, but it was her first day of like preschool, so there's just a lot of things. Yeah,
that's fair.
I did try to bribe her with donuts. It worked for about an hour. So
sugar always has that backfire, right? So I am Murse Cal. I am an RN that works in geriatric long-term care and short-term rehab. I live about 2.5 hours from this hospital. So I have had friends who work there.
Excellent. Well, thank you for being here today. I appreciate you. Everyone who has the social medias. Chad, did you say you were getting social media?
I've started to build out a YouTube channel. I've got it built. I don't have any content yet. If anybody wants to make suggestions for the first 2 or 3 videos, I would love to take suggestions.
I have so many suggestions.
Throw it to me in a chat or something.
Please let us know. This is going to be wonderful. Also, I feel like I'm slowly forcing everyone to go this way. And Cal, you should feel pressure. You should. We're going to make everyone have a channel. We have HW says Grady TCICU here. Can't wait to hear everything you have to say. So Grady, hey, hold one moment. Okay. Okay. Grady, for comparison's sake, hopefully you can't hear her screaming too loud. So if we're looking at Atlanta has 2. So Atlanta's in Georgia. 2 level 1 trauma centers, and one of them is Grady, and they have like 900 and some beds. And they level 1 trauma center basically just means that you can take pretty much anything that can walk through the door. You have a OR that is always staffed. You always have surgeons there. You always have a ton of team of healthcare providers, so they can handle anything that's going to walk into their doors. They don't have to ever say really like, oh, we can't handle this. We're going to send you to the hospital that's one step up from those. Those are obviously very important to have because they're going to be able to handle any car accident, gunshot wounds, stab, anything that's going to happen, which we know in cities, more things happen because there's more people. So when more people are there, more things happen. And Grady, which is the other hospital, is already overwhelmed. So at least from what I've heard, HW, you can tell us if this is true. From what I have looked at, like they are already having situations where they're having to like turn people away sometimes, go into different, situations. And it is not ideal. So if this one shut down, if there's only two and one of them shuts down, that is a rather large problem that we are looking at. I have an article that we're going to kind of read through to give us some structure, and we're going to go from there and we'll see. But we have Nurse Adrian here also to give us all of the legal perspective, which is perfect. Chad, did you say your handle was going to be Mr. Midwife?
That will be me, Mr. Midwife.
Okay, perfect.
I'm in the group chat if you want to look at the icon.
Yes. So we will link your new social media down below. And we will go. So let us see. Okay, true. HW says true. That Grady's already pretty overwhelmed. So if you take an overwhelmed system and say, hey, we're going to add another half of everything we already had going on over to you, we'll see. And this is a problem. You might be like, Liz, why is this even like, what does this matter? There are implications of things that we can actually do to, in the future, let people know again, like, hey, this is how we could maybe help keep this from happening. And we're also going to look at how Wellstar is the villain, because even though this hospital, they're closing their doors. Essentially, they're saying, hey, in 2 months, we're going to close our level 1 trauma center because we can't afford to stay open because we're losing money, which is true for that location for reasons that we will get into, which are also preventable. But many people woke up and decided they were going to be the villain. So now the hospital's losing money. And but Wellstar as a company is making money. So big feelings. I'm going to pull this up. Anyone else have any initial thoughts? Big feelings? Anything? We have feelings. Oh, Adrian, if you would like to introduce yourself.
Hey, you guys. I'm Nurse Adrian RN. You can find me here on YouTube and on TikTok. The size of Atlanta is massive and growing. And like all growing cities, healthcare is going down. Access is going down as cities get bigger. I mean, Atlanta is, a very large metropolitan area. And, the concern here is one, obviously it's only one of 2 trauma centers, level 1 trauma centers, but also that this is a hospital that ranked number 2 in inclusivity and diversity of their patients who they took in. The article mentions that. So there's a lot to unpack here and a lot more analysis that hopefully, we'll start to see about this system and how this all came to be, or what really is the reasoning, because I've yet to see a reason.
Mm-hmm. And I think that's a great point. I think one of the biggest things that gets me mad about this is if you do look at who it's going to affect the most, it's going to affect people who are already struggling. It's going to affect, once again, I mean, we see it time and time again. It's going to affect people in the BIPOC community. It's going to affect people who are low income, people who do not need to be like bonked down anymore by life and our country. And this is mostly going to be affecting them because other people can afford to either go outside of the city or already do, or they live in suburbs. So,
Right. Kind of along with that too, even though people who may have more benefits or access to care, when it comes to a trauma situation, you don't want to have to go that far. You have a 30-minute window. So by them closing this facility, it's going to be detrimental.
That's a really good point. Yeah. You don't have that time. When you have things, and they were a huge stroke center, and with strokes and things like, other things like when you have injuries, obviously too, but with strokes, like timing is everything. You have to get people in and get the medication to hopefully break up if it's a clot, like quickly. Otherwise that damage is permanent. And what if you have to leave your city, it just doesn't make any sense.
A little bit of framing too on this is that Georgia ranks 50th in Medicaid spending. And this is Atlanta, Georgia, so the state of Georgia, right? And which is really baffling because a lot of people may not even think that or understand how Medicaid works, but it is state by state allocations. And this is a government system in totality that is year after year rejected increasing Medicaid spending, allocating money, or expanding who's eligible for Medicaid. And so that really goes hand in hand with the impact that will be seen and felt by the poorest people, the most in need in the Atlanta area, and it'll roll over. Obviously, and we'll talk more about that, of course.
Yep. And I was going to talk about like Medicaid. I have a couple websites for like Medicaid expansion and how like that plays into that, because this is huge, because basically Georgia is doing this to themselves in a large, or not Georgia, but like the legislators in Georgia are doing this to themselves and being like, oh, well, I don't know why this is happening. It's because you woke up and decided to be the villain. That's why, Georgia. That's why. Okay. Atlanta reels after news of Atlanta Medical Center closure. News of impending closure of Wellstar's Atlanta Medical Center, one of the two level 1 trauma centers, has nearly 500 beds, has struck. They've decided they're going to close. The closure, he wrote in a letter, will leave an open wound in the heart of the community with no articulated plans for its conversion or transition once the hospital ceases operations. They basically just said, we're going to close in like 2 months. So I don't know how that even happens. Like, what do you do with all your employees? Like, that just, I don't get it. People are saying that they're like, prioritizing profits over people. This is leaving. That's a ton of beds, a ton of hospital beds. They've closed other emergency rooms. Wellstar has. So to me, it looks like Wellstar's kind of a huge healthcare system. And it looks like they're closing a lot of the downtown locations, places where they're probably having people who are paying more by Medicare and Medicaid. So the reimbursement is lower, and prioritizing things more outside of the city. At least that's what it looks like. They've closed other ERs. And yikes. They do have a loss of money at this one location, but like I said, there's financial documents. I will leave them linked in the description. I am not going to pull them up because they're confusing, and I'll just show you where to go. It's like one line where you can kind of see like overall Wellstar in general is making a profit of millions and millions of dollars. This hospital isn't, but it's more than enough to like pull over. And if you actually cared about patients, you would think, oh, we will use our profits from these other hospitals and maybe like cover this one because we're decent. But they're like, no, we won't do that. We will be the villain. It says it's exploring all legal options to stay open, while also saying, but we won't. We're going to be closing. People in Georgia are understandably freaking out. They are, different legislators are trying to say like, let's stay open. But unsure if that will happen. They claimed elsewhere in other articles that one of the big reasons that they feel like they have to close is because they don't have enough. They have so many people that are not insured at all that end up coming in, or they have so many people that are Medicaid that they're not being reimbursed properly. And it's all these people that keep showing up for healthcare, even though they can't like have the audacity to not be able to afford it. They're the ones that they're blaming them on. So they're saying like, not only are you not able to access healthcare, but how dare you show up when you're dying, even though you had the audacity to not be able to afford something that should be a human right. So we can share thoughts initially, and then, or any insights that any of you have. And then we can kind of go over like Medicare, Medicaid, how that plays out, what the insurance gap kind of looks like.
I want to draw an analogy really quick.
I love it.
Let's say that there's a supermarket, okay? This supermarket, if somebody comes in, says, hey, look, I need some bread and milk and eggs, that there is a certain amount of staples that they have to hand out to each person. If where they maybe get reimbursed okay, probably they end up taking a loss for a variety of reasons. If this supermarket ends up going out of business because of this, what's the problem, right? Like, should whoever owns the supermarket be made to continue to keep it open to provide this service? And for me, the bottom line is that like corporations, well, my motto is all corporations are evil. Like corporations are built to make money, bottom line. And if you have an area that isn't making money and you are not supplementing that loss where they can at least break even, like it's not going to last. And while this isn't the quote unquote moral thing to do, and it's going to be really unpopular for a variety of reasons, and it's bad for a lot of people, at the same time, like if you're the grocery store owner, how do you feel if you have to keep on taking a hit? Is that fair either?
And that's the problem with having your healthcare system built on capitalism, where it's all for, profit, versus if you have it in a more bigger expansive thing, other areas can cover each other, and it's kind of in everyone's best interest to say, like, keep the playing ground kind of equal. But you're right, I mean, financially it doesn't make sense, but they're still the villain because they're the worst.
On the other hand, sometimes you have teachers, school teachers and stuff, that complain about the low salary. You know what you're getting into when you go into teaching. As a midwife, I can't complain about having to be up at 2 o'clock in the morning to deliver a baby. I know what I was getting into when I signed up to go to midwifery school. It comes with the territory. I have to take call. I have to be up at odd hours. It's what you get. When you buy a hospital or you're a hospital corporation, you know what you're getting into when you go into business in hospitals. You're going to lose money in some and make money in others.
Mm-hmm. And overall, they still are making money.
Yeah.
But yeah.
When the CEO's making $5 million on his bonus,
Mm-hmm.
I'm sorry, it's there's some cash to be otherwise allocated there.
Yep. The other thing too, I mean, let's keep in mind now, this is a system. Wellstar bought this system of hospitals from Tenet Healthcare just in 2016. So we're not going to buy a big system and then expect, well, we're going to have this phenomenal turnaround in 6 years. That's unrealistic, especially given that 4 years after the purchase of these hospitals, which I can't remember how many they purchased from Tenet in totality, but I mean, we had the pandemic. Everybody had to deal with the pandemic. This hospital bore the brunt of COVID patients in Atlanta for the longest period and had the highest census of COVID patients by more than double of the other two large medical centers in Atlanta. They are nonprofit. So they purchased from Tenet, which was for profit, and now became a nonprofit, which is Wellstar. So there is some expectation if a hospital is not paying property taxes, is not paying income taxes to the federal government, that they are going to, do a little better. And of course, when we look at compensation, I took a look at some of the compensation for top executives. I mean, their CEO, I think, was $3 million, which is a far cry from $300 million for the HCA CEO for the entire system.
Still.
And overall, Wellstar, this hospital, is one of the better paying hospitals as well. So there's a whole fallout that will happen as a result of all these people losing jobs. I wanted to point out also that, and I talked about this before, about disproportionate share money. So CMS awards disproportionate share money for underserved hospitals and healthcare facilities that serve underserved populations. They, by and large, this hospital got $23 million in 2019. This was about, I'm just looking very quickly. The next hospital down got $4 million. And then it's very small. So they got a ton of money, right? I mean, so again, this is not to say, oh, they've got all this money, but to say that this is the population that they serve. So, I mean, basically there's 10 other hospitals that we could add up here, or even 15 that didn't even get 22 million on the entire list here of those eligible in the state of Georgia. And so they're, when you look at the financials overall, they have made money as a group, because you're looking at balancing out. The bigger, you're going to lose some places, you're going to make money some places. They just invested a large amount of money in infrastructure, is my understanding. And yet they have not actually given a valid reason. They're projecting, okay, we're not going to be able to meet this. And at the same time, also in Georgia, there's no laws that actually stop a hospital from closing. In some states, like in California, you just can't announce a closure. It would take a year. The governor can stop it. The assembly can stop it if you're especially disproportionate share. So again, this speaks to the laws of Georgia and maybe some reform that's needed by the citizens of Georgia to really take a look at, one, who are you electing? How are these people that you are electing to state legislature and governance and as a governor being good stewards of, the money, the resources, and of healthcare? Because if you don't have healthy people, you're going to have a whole lot of other problems. And this is going to do a lot. This will be a big hit for companies to attract workers to Atlanta. Trust me. If I was going to go move to Atlanta, I would be thinking twice, because the rollout of this will be no doubt felt, especially as a level 1 trauma in a city like the size of Atlanta. And I've just luckily, fortunately, been there to visit twice this year, which is a beautiful city, an incredible, beautiful, very large city with a lot of complex issues. But I mean, they've got, 1 foot in modernity and 1 foot in, 200 years ago. And this chasm is only going to grow bigger if there's not serious reform done. And the people that are voting are not starting to elect people who are good stewards for the citizens of Georgia.
Mm-hmm. And I think people don't understand, you know what I mean? Because like it's difficult unless you're really in it to hear. They're like, oh, well, you want to, I lived in North Carolina and we did not have expanded Medicaid. And they would like tout over and over, like, you don't want to expand Medicaid and give more money to the poor people who aren't even working, who are at home on their couches like bums. Well, you're working so hard to go and get your insurance. Like that's very much how it was presented to the public. And I had countless arguments with people. I'm like, you have no idea. Like, no, this is costing us more money because it's so short-sighted of saying like, oh, we're not going to fill like the gap. And we can talk about that in a minute of like what that kind of looks like and means, because this is very much like J. Curl said, this is what happens when healthcare is based on profit. Like you cut your losses, you cut the thing that is not making you the most money. That is a smart financial decision, but this isn't like, this is people's lives. And so maybe it should be a little bit different. Hello, Sophia. I'm glad you agree.
It's really scary because as a trauma nurse, not everybody can take care of a trauma patient. You're talking about rapid infusions, ICP monitoring, A-lines, all these things that you can't just send off to another hospital and expect everybody to take the brunt of it,
Or even have that equipment.
Exactly. The equipment, patients are on 6 to 7 IV drips at a time. So it makes you wonder, how do they plan for this to work?
Yeah.
And when it comes down to like trying to navigate and avoid the closure, I wonder if they stopped doing like elective surgeries or maybe thought about closing specific units rather than the whole hospital itself.
Mm-hmm. Kathy said that AMC has been in business, so Atlanta Medical Center has been in business over 100 years. I believe this is planned by Wellstar. The current patient population is over 80% trauma. The services that make money. So in case you're not familiar, when you go into the hospital, usually like handling trauma or like run of the mill illnesses are not what is making the hospital money. So the things that are making the hospital money is usually their cardiovascular center, their orthopedic center, their surgeries that are going to be pretty high yield and have a decent chance of people recovering. You're not getting a ton of money from people coming in with a gunshot wound and trying to fix them up. You're not getting a ton of money from grandma who comes in with a UTI and then is going septic and is going to be laid up in the ICU. Like you're just not getting a ton of money for strokes. Things like that do not bring in a lot of money because the way we reimburse is very backwards also, in terms of like how much you get paid for different things. And she's saying that they moved the money makers away from AMC, which also detracts from the hospital. So if you move your cardiovascular, if you're going to like, when the ambulance comes and picks you up and they say like, oh, well, we're going to take you over here to this hospital. Or if they take the orthopedic center out or like they say, well, we're not going to do any more like cardiac cath lab stuff. We're not going to do that as much here. We're going to move that to a different location because that might not be emergent. That hospital is going to take a huge hit. So it's also kind of orchestrated, if this is true, to kind of shuttle the moneymaker elsewhere and have this hospital kind of be like, oh, well, I mean, they don't make us any money. Well, you kind of did that by deciding what type, like who is going to be able to go here and what services you provide. Most hospitals have both. They have their cardiac, whatever. They have their things that are going to bring up the money, all the elective surgeries to kind of balance it out. But if you tip that scale, yikes.
So there are a few other factors at play. Adrian, you'd brought up the fact that this is primarily dealing with low income and minority sections. A lot of times there is higher reimbursement for hospitals that focus on low income reimbursement, rural, for both Medicare and Medicaid. I want to say about 3 months ago, there was a Supreme Court case where basically the people in Medicare and Medicaid were being like, oh, well, we feel like it should be this for this hospital and that for that hospital. Part of this is trickle down from that because that is affecting how much pay for a variety of reasons. Another major aspect, I lost my train of thought. While there is a effect on choosing where they're kind of like shuttling their care, to some extent, it's still, there's only so much diversion you can do of a lot of that care, because if you're thinking that a major hospital in this area is going to shut down without any sort of implications on your other systems, like, that's going to happen regardless. That's not optional. And when we're already talking about the other primary hospital already being bursting at the seams, like, you're not going to be able to fully divert that loss or prevent that loss from closing down this hospital.
But I think we did see that they had not lost money. So I actually pulled up their balance sheet. It's about a 50-page document, and their financial report, actually, their audit report.
Yeah, that's what I looked at, and I was like, thank God for Adrian, who might understand this.
I apologize. I'm a little under the weather and didn't get my antibiotics today. So, so I didn't have quite the focus I wanted to have to really analyze some of the financials. And I'm certainly by no means a financial expert. So, but anybody in the audience who's watching this or watches us down the line, please take a look at their financials. I'd love to hear anybody, we'd like to hear anybody else weighing in on this. But I mean, again, this is a system where you look at, like, okay, they've got, I think, 5 hospitals. They closed Fulton, or they bought these 5 from Tenet. It was, I don't know, $500 million, right? Or something like that. Now this property is valued at over $100 million. But again, there's things that you put into place beforehand. And from all accounts, what we can see is that there wasn't really anything put in place to mitigate this before this announcement that was really part of public dialogue, which is really kind of baffling. Again, coming from California, where there's just so much oversight to make sure that, healthcare is protected to the best it can be. And of course, again, because this is level 1 trauma, this is going to become a very dangerous situation. But yeah, so that's exactly the document I pulled up. So, right. So in totality, you're looking at, this is you're going to expect some hospitals to make money, some hospitals to lose money, but the disproportionate share, Cal, which I think you're speaking to, where they get a higher reimbursement, right? They got $22 million. I mean, the next highest hospital in the entire state of Georgia got $4 million. So they got 5.5 times more than the next hospital in Georgia, in the state. But I think, again, this speaks a lot to Medicaid, the Medicaid program, the failure of the Medicaid program in Georgia. I want to emphasize this a lot. For folks to understand, Medicaid is not equal across the board, across each state. We live in the United States of 50 states plus every district and province or whatever. And so it's not equal. There's not equal access to healthcare, and states are allowed to decide where they want to allocate that money. And so again, it's like, it comes down to, well, where are these workers going to go? Where are these doctors going to go? I mean, how is, when you look on the other side of it, the employee side, the physician, the provider side, and also the infrastructure of Wellstar, to me, there's just something going on here that is not out in the open. That's not really transparent. We're not seeing.
You know what? I was wondering is it possible there's a political play here, that because 2 months is a really short notice, short notice.
Yeah.
And so is there a political play here that they feel like they've got some politician over the barrel, and all they're doing here is posturing until they get their way? It's trying to get someone else to keep the lights on for them. You know what I mean?
Well, the state is, they're about to allocate, I think, $11 million to Mercy Hospital. There's a movement.
Well, if
right
they
now,
get 11, then I want 25.
But that's to Mercy to offset the care, what's going to be needed to take care of these patients overflowing from Atlanta Medical Center. This speaks to, basically the there's no other way to put it, right? The disenfranchisement of people, of people of color, of poor people, people that don't have access. But again, and not everybody lives in a big city, but I can tell you, like a city like LA, for example, has the fewest, I think, of any large city per capita NICU beds, technically making it the most dangerous place to have a sick baby in the country, right? You think of, oh, there's all these hospitals, you got a big city, you're going to have great healthcare. There's this expectation and assumption, but in reality, it's kind of the mid-level areas. I mean, you go to upstate New York, there's a hospital every corner. It's very different. So again, this is a nonprofit hospital system, paid no property taxes, pays no federal taxes, right? So we got to keep this in mind, that there has to be a higher standard for them. But those are rules that are then set by the state, not the federal government. So this falls under state rights. So again, it's something for the citizens of Georgia, politicians, the voters to really think about as they're interviewing candidates, as they're moving forward, and who is going to best represent the greater interest. Because it doesn't matter if I'm a millionaire and I've got a trauma, I'm still going to be competing with somebody who doesn't have insurance, and it's not going to push me to the front of the line. This is a thing. And I've seen this over and over again in LA with Cedars-Sinai, UCLA, St. John's and Santa Monica. People think, oh, I'm going to get the best care. You know where you're going to get the best care? LA County Hospital. That's where you're going to get the best care, is LA County Hospital, because they can handle it and they know how to manage things, and they have a system that's very consistent. I trained in all of these hospitals as a student nurse. I worked in several of them, taking care of private duty patients in several of them. There's not this, when it comes to healthcare, money may get you to the payment part of it. It's not actually going to get you in the door the more that you're competing with people that are not insured or underinsured, because the system, they have to see who they see in the ER and triage according to triage standards. And you all can speak to that more. I'm not a critical care nurse. But again, this will hurt everybody. This will hurt everybody, no matter who you are.
Yep, for sure.
Yeah. Two things. Oh, okay. You brought it up. I was just going to speak on the Aquarius. How do you think that will play into it?
So if you're listening to this, so Aquarius Nelson said, let's also keep in mind Wellstar was, I think, dinged for their offshore accounts in the Caribbean that was not disclosed. So oops.
There you go. That's something they didn't disclose in this article.
Yeah. So interesting. So they had, if you don't keep your money here, you can't obviously be held accountable for it, or they can't be like, oh, you're like, oh, my profits aren't here. They're in the Caribbean.
Again, there's always ways to reach overseas. But and again, I don't want to sound like a shill for corporate America here, because I hate.
No, we need the other side, because I'm just rageful and I'm like, they woke up and decided to be the villain. So we need you to have a balanced conversation.
To some extent, I do think that some of this is a political move to try and be like, hey, look, you need to pay us more from the local government. I think it is a dangerous game of chicken in a lot of regards, but I think it's one that they can probably, given their size, threaten to pull off. But at the same time, one of the things that I keep on hearing, or that I've heard a couple of times, is that having a healthy population overall is more beneficial for the state, the union, the whatnot. And I want to go back to cigarettes in the 80s. There was a thing called the death benefit that was brought up in, I want to say it was Romania or Poland, talking about how much money, if you factor in how much shorter lifespan was because of the effects of cigarettes, and how much less the government had to pay out in the long run. If you're looking at this from a purely financial standpoint, having healthier people does not necessarily mean that it's beneficial on a financial page. Having people die early, and it sounds terrible, and it should,
it's beneficial.
but there's a lot of benefit to that cost-wise.
Are you saying the cost of that people that are ill? Well, here. Let me throw a little fact on you. Let me throw a little data on you. So for the millennial population here, which I don't think maybe Liz, maybe you're up in the millennial. I don't know.
I'm an elder millennial. Thank you.
Okay, got you. Mama nurse, I'm not sure, but so millennials are looking at, because life expectancy is expanded, right? So of course the whole healthcare system is theoretically just going to collapse under all that, because people are just living longer in general, right? And that's just a bigger issue to deal with. But in general, the millennials are going to have the most unwell years. On average, 15 unwell years is predicted in their lifetime, which is a phenomenal leap from the baby boomers, from Gen X. I mean, because we're talking about, if you have a life expectancy of about 95 versus 77 or 82, and that is going to be a huge burden on the healthcare system, which we haven't quite figured out any of that, of course. But in general, when we're talking about, as far as these health systems, it becomes down to what is the obligation of a health system, of a healthcare corporation. And then where does it cross the line of like, okay, where does the government, get to come in, and just an analysis of our whole system overall, right? I mean, I'm part Canadian, we have a universal healthcare system there. It's very different because you don't have 15, 20% overhead dealing with insurers. You go into a clinic and there's literally a NP and like a respiratory therapist, and you just get care. It's not that complicated because you don't have all this, you don't have a doctor's office that has 10 people working to do billing. Yep. The overhead, costs in America are part of the problem as well, because why is it even complicated? Why is it there's all this, this paper, rock, scissor game or whatever shell game going on about what the reimbursements are? Oh, if you're Blue Shield, you get 62% on the dollar, or you get 52% if you're this, and but you never get 100%. So why do we even talk about 100% what the bill is, right? So I mean, it's just the system is so convoluted. It's not a simple discussion. It's not a simple answer. But we do need to start looking as the American public at our system and efficiencies, because there's so much waste in healthcare that's actually not about giving care. There's so much money spent that is not about direct care, that really doesn't even need to be in place. Yet all the systems and automation we do just funnels a lot of money to EHR companies and actually doesn't reduce the overhead, which is, people can complain about the VA or Kaiser, but they run on these amazing margins, 7%, 8% margins versus, 16 to 20% of other companies. There's something we need to look at these models of, okay, nothing's perfect, but how do we streamline this? And do we really have to get to universal health care? Because if we don't give people preventative care, we just reward at the wrong end, right? And we're just all conditioned to it. We reward at the wrong end. We don't give a provider. We're not saying, hey, Liz, guess what? If you have 100 patients and 50 of them don't come back for anything, you're going to get an extra 20 grand. We don't do that. We don't reward. There is zero reward in preventative care. Nothing. I mean,
and there's zero money in those visits too. So like if you, like when I billed for let's say someone was in my office, it was a regular complicated thing. They had 3 chronic conditions. They had diabetes, high cholesterol, and high blood pressure. And we were going to talk about all 3. We're going to manage their medicines. It's what's deemed like semi-complicated. I could bill that as 99214, whatever it is, and it would be $66 for what I did. If I was a orthopedic person, their billing gets reimbursed at $395 for a 5-minute appointment of a similar of a same thing. So like we don't pay. Yeah, the whole system is just like upside down and backwards.
And Liz, you make a good point. I spent a full third of my office visit trying to pick out the right ICD-10 code and verbally write and get the right verbiage in the document. So that I can get the highest reimbursement, because I either get paid $10 for this visit or I can get paid $50 for the visit. Depends on the ICD-10 code and what I've written in the chart and whether or not they support each other. And it's a full third of my time is trying to pick out the right ICD-10 code. It's a pain in the butt.
Right. We've seen in these hospitals, there's staff that what are they called, Liz? Or you guys, they're not case managers, but they go through the new chart reviews. I worked with them when I was
billing and coding.
Right.
Mhm.
So they basically go through, right? So we had about 6 of them in my 212 bed hospital. So they were all travelers. So let's just say they were making about 150,000. They were paying about 150 to 175,000 per pop per each of them. Right.
Mhm.
So there's just money just being wasted in a system that you shouldn't have to have that. The system should be self-correcting. The AHR should be self-correcting. It should not be as complicated as it is. And we spend way too much money on all these staff to go through charts. Oh, fix this, fix that. And then providers hate it. They despise it. I mean, they would always come to me like, hey, while you're talking to that doctor and train them, can you have them fix this note, that note? Like, they're always trying to bribe me basically. And so I learned a lot from them. And I was like, this is a job. Like,
Mhm.
and I was a certified coder also. And it is just immensely complicated. It is immensely complicated. And if you make one mistake, it's like off with your head.
It's off with your head. Or in situations, so kind of going into like Medicare, Medicaid. So Medicare and Medicaid are the like government run insurance companies where if you are either you age into it or you have some kind of like chronic condition that puts you at a disability, or if you are under a certain poverty level, you can qualify for Medicaid or Medicare. And they traditionally reimburse poorly, and they're also very punitive on healthcare systems and providers. So one of the huge issues that we see with them, so let's say you even have this, if anything happens to you, I think we talked about this in the last stream, and like you happen to get out of bed and stub your toe, and then your toe gets infected while you're in the hospital, Medicaid will no longer pay for that visit. They say, well, you did this to them. They didn't walk in with it. So now it's your problem. If one of my patients in primary care came to me and they said, well, you didn't ask them if they had a colonoscopy. And I was like, they weren't here for a colonoscopy. They were here for a sore throat. Well, they said, well, you should have asked them. So we're not paying for this anymore because you hadn't seen them in a year. I'm like, well, it's not my fault that they didn't show up. And they're like, and they came in for this sore throat that I did not ask about their colon cancer screening. And so then they will no longer pay. So they have a ton of rules like that also dip into this hospital, obviously not getting reimbursed because.
Yeah. And so as a hospital, as a provider, as an entity, I end up working for free a lot.
Mm-hmm.
Or working at my own cost. I end up paying the bill in a roundabout way because I didn't say it right, or I didn't code it right, or
I didn't click the right button.
It's impossible to keep them happy. It's impossible to keep them happy. They look for a reason to not pay, and they will find one.
To be fair, the flip side of that is recently I had a patient sent out to the ER, to 3 different ERs, 4 times within 72 hours. 3 of those visits are not being paid for.
Yep.
This
if you get readmitted, they don't pay for it.
One of the diagnoses was like urinary retention. Another was like UTI, because part of the way the system works is to, okay, we have a diagnosis. This solves your problem. And we're going to send you on your way before we accrue any more costs so that we can get paid for this. And instead of, I could have told anyone from how this person was acting that this wasn't urinary retention, this wasn't UTI, and that if anybody had bothered to actually talk with the family, go through the chart, they would have realized, hey, look, this person has a history of kidney stones. Everything fits with kidney stones. But because that can also fit with a lot of other things, oh, well, we're going to slap you with this, we're going to slap you with that, and then send you back because that will clearly solve your problem. And, when you have a system that's designed to be as short as possible, instead of actually solve the problem, to, slap a code that we can bill for and then send you on, that's what you're going to get.
Yep. Or if you don't have the community resources to handle it too. So like they're trying to get you in and out really quick. But like, what about all the people who are like in the Atlanta situation? If we know that hospital served a ton of people who had low family resources in terms of money and probably access to other things. So, and we know that they probably they probably have Medicaid if they have insurance at all. They show up, the hospital pays for their first ER visit. But if you do get discharged and come back, they will no longer pay for any more. So the ER discharges them to go home, and they might say, follow up with your primary care. There might not even be primary care, if they even have one at all, if they can afford it, if they can get in. Or they might say, oh, just go to urgent care. Go have your family take care of you. Go have X, Y, and Z. But the person probably goes back to work the next day because they have to go to work, which makes their condition worse because they don't have time off. So then they show up back in the ER 2 nights later after they were like, well, I couldn't do the thing you told me to do because I don't have access to those services. And now Medicaid's like, well, I'm not paying for any of this because your patient got worse and you didn't fix it.
Now, speaking off of that, Liz, I'll be honest, I started my nursing career in Florida. And when I did my travel assignments in Texas, they did a really, really good job of keeping those patients in the hospital that they did feel would go back to work the next
Oh, that's
day,
good.
or
Yeah.
anything like that. And it was the most amazing thing that I seen, because we had one patient in particular drinking, got in an accident, but had a family in another country that he was providing for financially. They kept him in the hospital for like 2-3 weeks, even though he was okay. But we just knew that if he went home, he had a cervical fracture, he was going to hurt himself again.
Yeah. Yeah.
Bravo
well, that's
to
good.
them.
I'm glad they
Bravo
did
to
that.
them.
North
Yeah.
Carolina did not care about people like that. They were like, all right, bye.
Most places don't care. Most places
That's-
don't have the resources to be able to just house you or put you up as a hotel stay for days or weeks or however long.
Yeah.
Mhm. Yeah. I can't tell you how many people walked into my office who I'd never met before. And they were like, I just got discharged in the hospital. And I was like, well, that's unfortunate. And they were like, I need you to give me a bottle of pain pills because my shift starts at 3 and I have to go. And I'm like, okay. Like, okay. This is quite a way to meet.
Well, this is why, like the on-demand online health services are expanding. I mean, actually today I just myself needed healthcare and I'm in between insurance and I'm looking up urgent cares and I'm looking at, $145, $200. And I was like, okay. But more than anything, I just didn't want to leave the house. And then all of a sudden pops up like $35 online visit, texting. Great. I already know what I need.
Yeah.
I already
You're
know
like, well, this
exactly what I
works.
need. I've got a sinus infection, ear infection, and, it's going on 3 weeks, hasn't gone away. It's getting worse. And I'm like, so I was like, great, for $35, I can do this. And many people could, right? But again, that's super basic care. Of course, we wouldn't want to do that for anything complicated, a remote or people with, multiple things going on. But this is, what is going to start filling up a little bit of that gap. But still, it then comes to access. And are you going to know? Are you even going to know to look for that, right? When you've got, I think it's like 20% of Black population is uninsured in the Atlantic area. It ranks fairly high in uninsured Hispanic population. Again, like Cal was saying about the Supreme Court case about, I think, were you talking about that, the Medicaid expansion? I mean, Georgia was one of the 24 states that opted out of Medicaid expansion in 2012, right? So again, Georgia's not alone. They are not alone, but they, have the opportunity to do better. And in a state that is really growing, is really, especially Atlanta. I mean, you look at Atlanta and you think, oh, this is like a great place to move to. It's a great place to make decent money, to, expansion of business. It doesn't have all the same kind of stereotypes of the South, maybe. But again, it comes down to healthcare. What families are you going to draw and attract there as an employer to this area, given the state of healthcare? Again, it's going to be everybody competing for that same provider. And again, I mean, if anybody, I don't know how many of you have traveled in Atlanta or been there, but I mean, it's a pretty busy city.
Yeah.
They have a pretty significant crime rate. I drove through Atlanta. It reminded me of driving through south of France. It's a lot of, there was about 10 accidents, every block. I don't know what their trauma numbers are. I didn't have a chance to look it up, but
they're pretty at that hospital. It's pretty big.
It's pretty high, right? I think they had, I mean, I haven't been able to find it, but I'm sure it's pretty significant. I mean, the EMS system is very busy there in the Atlanta area. I can attest to that just visually, just seeing it myself. But again, it comes, like what I'm just curious what the public is thinking about this, because they've had so little time to respond, to this. I mean, this announcement just coming, a few days ago, and in 2 months, I mean, to me, that is malpractice on the board. I think the board of this hospital needs to be held accountable. If I was a citizen, if I lived in Atlanta, I'd be finding out who was on the board. I'd be rallying people at their houses.
Yeah.
I'd be doing something, because this is really, irresponsible to give a 2-month window, especially as we're going into winter, right?
Yeah.
Especially with everything else going on. We have yet to see, I mean, it's one thing. Okay, could you survive? They're giving an excuse that, oh, well, our projections for the next 5 years, or, they don't even have an answer, right? They just thought, I mean, somehow they were just going to like make this announcement, close, and nobody was going to notice. They didn't even have a PR, really good, well-spun PR answer for this.
Right.
So even if you're looking at projected losses, okay, well, so you're saying you couldn't stay open through the winter season. Certainly when we look at their balance sheet, they could, no problem whatsoever. And because disproportionate share money, they're going to get a lot of that money in the winter months when they have more patients coming in. I mean, if you look at the money, you look at the dollars, there was nothing urgent about closing this hospital, and they closed Fulton. So, they've already liquidated Fulton, right? So let's keep that in mind. So it's, again, what are they planning on doing? This is prime real estate right by the airport,
And this is exactly why I think that there's a political aspect to this. They're using this as leverage.
And if you're unfamiliar, we're about to go into an election season where we're electing a lot of governors, a lot of people in the state level. So it's not a presidential cycle in the US. It's like we're electing a lot like governors, people in local government, Senate, other legislators. So that is what we're coming up on November 6th, I think.
And they're due to close in November, and the election's going to be in November.
Yep. And I know like and I know Stacey Abrams is a person who's trying to take over from I don't know the dude's name, who's currently running it. And I know she's been talking about that. Yeah. So I think it definitely it's going to give people a lot of things to talk about in a not great thing. Lakeitha said in terms of like, what are people there saying? I'm a former employer of Wellstar Health System. So sad this is happening. The location I used to work at was closed as well. So that was that other ER maybe. California Dreamin' said, every Emory nurse here, we're all wondering how this is going to work out. I bet. Oh, hi, who said Kate? The rhetoric of people not deserving to healthcare irks me. Me too, friend.
Yeah, I mean, I'm curious what people are thinking in Atlanta and what people are thinking in the healthcare system.
Yeah.
I mean, because also you've got all of these nursing students. Well, are you going to even have jobs now? Because all these staff and all these people are going to flood.
Well, and how many other people? It's not just like, I know we talked about like where are the providers going to go, but where is everyone else going to go? Where are the people who work in the kitchen, the radiology techs, the lab people, the environmental services, the people who work in the parkings? Like, this is so many people.
Right.
Yeah, we've yet to hear really from the inside, because I think that they're probably, I'm just going to make up and guess, no factual anything behind this, but I'm guessing that they've, pretty much told all the staff, don't say anything. You're going to get a compensation package. I don't know what they got at Fulton. Is that the other hospital? Am I saying that right? So. But it'd be interesting to hear from behind the veil and inside what's really going on, and what are the employees being told about this, Again, I mean, people, it's like, and I feel sorry for anybody who's got a house that they're about to close on, that's working there. Anybody who's got something big going on, their kids just went to college. There's a big impact here. And again, there's just no way possible that this hospital could not have absorbed whatever that they're allegedly dealing with, which is not apparent at all on their balance sheet. The balance sheet looks great. They're flush. They're flush with cash. And they have an A2 rating, but, so their credit rating is good. They're not like in a downgraded credit rating system either. So they have the ability to purchase and buy. So it kind of makes me wonder, a lot of unanswered questions more than answers really here. So anybody, while you're smashing that like button, find people who work there inside this hospital and, we need to hear from people inside the hospital. Like, what is the plan? What's going on? How are the other employers handling this?
If you want to anonymously accidentally drop something in my email, that happens occasionally, and it would remain very anonymous. Things just show up there sometimes. They're dropped. If that were to happen.
And these are all people who are now going to lose health insurance.
Yep.
Themselves.
Well, there's very little doubt that the hospital staff, the city as a whole, is undoubtedly in a panic. And it's to your point, Adrian, it doesn't matter what compensation package or severance package you give me. I'm looking down the wrong end of having to relocate, find a new job, move my house, pack up my kids, restart my life. It's you can't pay me enough to compensate for that.
And you're losing all these specialty trained people, like
which is hard to get. It takes a long time to get up to skill.
Yeah. And if you are an ICU, you're specialized in this level 1 trauma center type stuff. They're going to leave. They're not going to just be like, well, at least if I was someone who was used to working in a trauma unit, a level 1, like whatever, I'm not going to go and work like you're like, oh, well, you can always find a job. You're going to go find another job that's similar. You're not going to be like, ooh, I'm going to go like plop in an art line real quick and then do all of these things. And then someone's like, would you like to go work over here? Like, at this like little hospital. The humans aren't the same humans. That's for me. That's for me where the risk is low. And I'm like, the chance of someone dying today is like almost 0. Yes, I'm there. Versus like Vanessa, who's probably like, we're going to see some things. We're going to see some things. I'm going to save some humans. Yeah. Like they're going to leave and you're not going to come back. So the city is losing all of these super specialized nurses and other providers, respiratory therapists, like this whole team is very good at the very sick humans and they're all going to go away. And that is not,
and even if they try to send all of these people to this other level 1 trauma facility, it still takes 3 to 4 weeks for the turnover to hire a nurse. And then on top of that, all of these providers won't be able to fit in that facility because when you talk about a trauma unit, typically we have 2 to 3 trauma surgeons, usually no more than that. And if that hospital already has that capacity, what are those physicians going to do? Where are they going to go?
They're not going to be happy if you're all of a sudden cutting all your OR slots. And they're like, well, you used to have privileges here and have all these OR spots. So now you're down to 1 day instead of 2. They're not going to be like happy about that.
Somebody asked, is this a teaching hospital?
It has to be. If it's a level 1, it has to be a teaching hospital.
Right. That's and I don't know
one of
what
the
their
requirements for
affiliation
being
is.
level 1, right?
It is.
Yeah.
So all those poor residents too, who are there.
Right. I mean, this is the thing. It's like, what are these medical students? What do? You just got picked for a residency. You're not going to be able to switch and, you just started July 1st. You're not going to be able to find another residency or internship in November. I mean, so you're going to lose the entire year. To me, again, the timing of this is really critical. And this is why, there has to be some consideration to state laws, to legislation that really provides some direction to this. And like, when's the timing of a facility? Just like, I don't know how it is in other states. In California, physician's practice has to open on January 1st and it can only close on January 1st because there's good reasons for that. So, maybe there has to be some other, looking at rules for July to June closures, in the low times and also to match up with residency, because this is a huge blow. And, you kind of think, well, they're willing to burn all these bridges with medical schools, nursing schools, surgeon groups, physician groups. That it's kind of unfathomable on that level, the amount of bridges that they're burning in this decision to give a 2-month window. I've honestly not heard of a 2-month window for a hospital to close like this without some contingency or some offer being made for somebody else to take it over temporarily, for the state to take it over, for whatever. And the other thing I want to talk about here too is that, we have seen the complete obliteration of the public health system in this country over the last 30 years. And this is another reason why it's so important to preserve whatever public health systems that we have, because those are the real safety net. But when privatization starts happening in public health systems and acute care, it just never goes good. It never goes well. We've seen it in California. We've seen it in Orange County. We've seen it in San Diego. LA's got a robust public health system. You know, it's very different. Ventura County has a robust public health system with 2 county hospitals. You know, there is a difference in the access to care and the consistency of care.
But Adrian, on the flip side, part of what you're arguing for is a philosophy of community-driven responsibility versus personal-driven responsibility. One of the things that you have to understand about the South is that it is very much individual, like, I'm responsible for my actions, I need to take control over this and that. And I don't think that's wholly true, in the same way that I don't think that where you're going in that you need to be cognizant of community complications or problems affecting things, right? Like, this is a spectrum where really and truly, when we're thinking about these things, there is, for all decisions, to some extent, I'm responsible for the decisions that I make. And to some extent, the decisions that I make are being influenced by the environment that I'm in, right? And there's back and forth both ways. And in the South, when you have this very, like, I'm responsible for the outcome of how well I do, or whether or not I become super rich because I work really hard, or, you know, versus like in California, where a lot of it is, you know, this is, you know, I don't have the same leg up that other people do. I don't have, you know, my parents can't offer this guy 5 to 15 grand multiple times in order to get into Stanford, Harvard, whatever else, so I can pretend to be on water polo, right? Like there is a different aspect of benefits, right? In the South, you tend to have significantly lower tax rates, whereas personally, my employer will never start anything out in California because of the complications of dealing with employees, risks, insurance, a variety of other things in that area, right? Like there's a lot of give and take, and what I think needs to happen is we need to find some happy medium between the two, because I don't think that everybody can blame their environment fully for what happens to them, and I don't think that everybody can fully blame the decisions that they make for what happens to them, right? Like it's not, it's really easy to get into this thought process.
It's a shared responsibility, but I think, and I hear what you're saying, Cal, but I would say, like with a trauma center, right? We all have an equal opportunity to get obliterated on the corner by a car. We all have an equal opportunity to be shot by anybody shooting a gun. So we're talking about trauma center, right? So if this was not a level 1 trauma center, you know, we'd be having a little bit of a different conversation and a concern about the public welfare and good, right? There's nothing that's saying, like, you know, somebody's not, you know, again, we have mass shootings going on in synagogues, in churches. We've got, you know, there could be a fire that breaks out somewhere. There could be some natural disaster, right, that happens. So, I mean, I don't know what kind of natural disasters hit Georgia in general, that inland area. But when you talk about like maybe hurricanes in certain areas, right, you at least, you know, it's nice to know, oh, there's a certain number of really trained professionals that can handle something in a certain area per se. And I think, you know, there is a different level of, you know, and I know that what you're speaking to also a little bit is just the disparity among states, right? I mean, when states compete against each other for different things, right? I'm in Virginia, Texas and Arizona are shipping people in buses to DC for no good reason, as if DC and the mayor of DC is supposed to do something. No, it's not funny, because these are human beings, and that's human trafficking. And these are people that aren't even being told where they're going to go. And the mayor of DC has absolutely nothing to do with federal policy. This is DC, you know, so it's impacting all of us.
That's a different discussion we can have.
I'm just saying, like, but states are, you know, they compete with each other, and they, you know, and again, that's fine. You know, one state might have a car inspection. Other states may say you've got lower income, no income tax, but you're going to pay high property taxes, or you don't have services, right? I mean, there's a lot of things at play here, but I think that we have to start thinking about solutions and about, you know, how do we, what do we, are we in this story of diminishing returns, right? At a time when we're really in some big infrastructure problems with supply and demand, just in general, right? I mean, we just went like 3 weeks without trash pickup because there's no trash people. right? I mean, so
Mm.
it's, and I live in a very affluent neighborhood. So again, this is the trickle down. It does not matter how much money you have. If, there are not people, if there's not somebody to fix your car, it doesn't matter if there's nobody to repair your car at the Lexus dealership, right? Or there's nobody to work on your house. And if there's no nurse to take care of you and there's no hospital for you to go to, and again, because of the, geography in Georgia's a big state, right? So we're talking the next level one trauma center is Savannah, Macon. I mean, you're going to be dead. You're not
Yeah.
going to drive,
Yeah.
4 hours to Savannah. You're not going to make it, right? So again, there's no way possible that in any model that this hospital could not have stayed afloat for 2 more months or 3 more months. There was nothing so urgent to have them close at this really critical time for the residents, of this area under any model. There's just they have provided no information, no backup for this decision. And, again, I think that there's a lot of things, again, at play, but as much as you have different states, you also have growth happening. So how will this impact growth in Atlanta, right?
Yeah.
How will this attract people? Because one of the big attractors of talent acquisition, part of talent acquisition is healthcare, education, and schools. I live in a part of the country that has 3 of the top school districts in the entire nation. It is a big draw. So people are willing to pay $800,000, $900,000 for a townhouse because this is one of the best, areas for education. Although it's gone totally downhill and we're facing the same teacher shortage as everybody, and COVID took, hit all students. But again, these are 2 of the big factors, as well as leisure, health grades, right? What's the health value of an area? Those are things that attract people. I mean, I'm somebody who's worked all over the country. And so I've luckily been able to see for long periods of time, like, also traveler nurses you get to see kind of the health of a community and the status of a community. And, and I didn't see it from the inside as a nurse. That wasn't what I did when I traveled a lot, but I got to see it from the perspective of healthcare workers working for a union and really being in the community, being involved with community members. And it's just, we've got to equal things up. We have the ability. If we have the ability and we don't do better, that makes no sense. It's like if we were still making cars that I had to crank up with my hand because we could do that, it still would make no sense if we were able to have better technology and do better and provide more. We just truly can do better. So I hope that people really, get together in Atlanta and figure this out, because I mean, it's an impossible situation though, because there is no time to react. And that's the part that's really the irresponsible part about these companies. And I think that this is the kind of thing that should have all politicians and voters take pause and think about, okay, well, they can just do that. They can just close in 2 months.
Yeah.
Right.
Is there something we could do to make that not
even give an option for anybody to take this over temporarily? I mean, versus, a year or 6 months. I mean, there's nothing imminent. It's not like, I worked in a hospital that had to close for 2 weeks because the windows were put inside out and there was a mold issue. And they spent, I can't even tell you, it was ridiculous. The day I started this hospital, they went to mold remediation and they were paying $50,000 a month for 10 years in legal fees. And then they finally had to close for 2 weeks, right? That took like 2 years for them to prepare for, because the impact in the community, as at the time we were a trauma center, eventually we lost trauma, the whole structure of trauma changed in my county. But, it's like there is an obligation, right? We're dealing with healthcare. So again, it's like, what is the obligation of healthcare organizations to these communities, especially nonprofit? Let's not overlook they got a big tax bonus. And I don't know, what that would have been. I haven't seen the math on that, but this is a huge tax bonus that they got, right, by being, a nonprofit status. So the expectations are quite different for a nonprofit.
What's the likelihood that some other corporation comes in the next 6 weeks and swoops this thing up and saves the day?
I think they were saying in the article that a lot of the other companies didn't want to touch it, if I'm not mistaken. I don't know if they've, reached out to everybody, but I don't know.
I mean, Tenet sold it, right? So Tenet sold it just 6 years ago. I mean, we know who the big player is in the South. You know, better than nothing, but certainly not, the ideal situation. So I don't even, that's the thing. It's like, and when you I don't know what's called, I say declassify a hospital, right? Having seen it happen and been, in the union where we have had hospitals close and had to move workers around. But when you activate a hospital, it's not a small thing. There are things that just get destroyed because you're no longer using them. You're no longer maintaining them to get things even fired up again, certain equipment. The cost of all of that is tremendous. It is tremendous. I mean, we saw it even in 2 weeks of a closure in our hospital. A simple mistake, like not checking the water pressure from the city water pressure to the hospital pressure, destroyed every toilet in the hospital the day we opened. And that was something 15 years later, still had not resolved itself. But, so, I mean, you can't just close down and shut down a hospital and be like, oh, next week we're going to crank the car back up and we're going to be, racing away. But I just think there's a lot more questions and things that we can think about and be thoughtful about in this case of like providing healthcare, especially in a large metropolitan area that is, has these rankings and statistics of uninsured populations, of Medicaid, access to healthcare, and how's it going to happen?
And Kara had said, question for the panel, how do we as nurses affect positive change against situations like this? I think part of it, and Adrian had said this last time, was like getting in contact with either your local news people, like sending your resume and saying like, I will be a touch person for you if you want it. If you have questions, actually getting to know your local representatives and saying like, this is a issue, because they probably have no idea that it's an issue. You know what I mean? And saying like, and this is why it's an issue. And hey, we should probably look into maybe expanding Medicaid to help get more things covered, because a huge reason that this hospital was stating that they were closing was because they had so many uninsured patients. Well, you have uninsured patients because your state refuses to expand Medicaid. And so a ton of your population, and they said like, oh, that would have helped. So if you're unfamiliar, I guess we can go through it really quick, so Medicaid insurance, if you're below a certain level, many states, so with the Affordable Care Act, part of it was they said, hey, if you want to expand Medicaid and kind of, so you can qualify for Medicaid if your income is below this, but you can't really pay for the Affordable Care Act and like insurance on the marketplace until you're here. So there's this gap in the middle where people make too much money to qualify for Medicaid, but they don't make enough money to buy insurance on the marketplace. And the Affordable Care Act kind of put it in the state's decision and said, hey, you can kind of bridge this gap by raising that bar and saying like, hey, you can make more money and still qualify for Medicaid, and we will pay for 90% of it. And you as the state will pay for 10% of that. And 20 whatever states said, no, thank you, we'll just do it this way. And then most everyone else said, oh, you're going to pay for most of it. Well, that seems like, the decent thing to do, because less people are uninsured. Because when you go to the hospital, even if you don't have insurance, they can take you to the hospital and they will have to treat you, and the hospital has to eat the cost. They can then apply for other things like different charity things to have like some of that built back up. But this hospital specifically saw a huge number of people who fell into that hole. So they had no hope of having anything they had done paid for. And so like things like that, where it's not popular to expand Medicaid in a lot of these states, because people see it as like, oh, I don't want to have to pay. Like, so just educating on that and like letting people know like, hey, it's 10% that the state has to cover, but we're going to save money because more people will have healthcare. So we won't be eating the cost of everything when we don't have actual services.
I'm going to take a slightly different tack than you. Make friends with malpractice lawyers in your area, because one of the major complications that a lot of lawyers run into is they aren't familiar with the electronic health system, with whether it is Epic, whether it's PCC, whether it's whatever else. And part of the problem as far as encouraging change is putting an actual meaningful slap on the wrist for a lot of these companies that, hey, look, we need to do better, and here's our plan to actually correct the problem. because nobody actually tries to correct the problem unless it costs money. Bottom line.
True. I don't like insurance companies, so someone else can go make friends with them. I will go talk to my other people. But that was excellent advice, Cal.
I wish
We're lawyers.
if only lawsuits actually resulted in some correction and change, we would see a lot of reform in an entire different industry in the United States that we don't. I would say that it's they eat it, they settle all the time, and that's just part of the cost, right? That cost gets passed on to the consumers, 100%. I think, again, this is more as somebody had a question here. For some reason, I can't do the comments.
Do you remember kind of what the vibe was?
It was about
Also,
Medicaid. Yeah. So $100,000 in insurance. Yeah. So, I mean, this is the other part, right? It's like, so what about everybody, these are things to think about, right? So let's just say, the hospital's closing, the facts, right? So they're going to close November 1st. Well, what happens to all the doctors and surgeons and everybody who's owed money? And how long is it? What are they negotiating for their health insurance, for their benefits, for their reimbursements, their contracts that they owe for payables, right? I mean, and I'm going to, give a plug to unions, because in a union situation, there would be some negotiating power about packages for these employees. But just on a business level, I'm sure there's a lot of other very large companies that are very nervous about this, again, because you have a trickle down effect, right? It's like when aerospace went out in Southern California, it trickled down. It was the closure of the mom and pop deli that everybody had lunch at. It was the little parts place. It was, there's a trickle down effect here, but there's also other big corporations at play in relationship with these big hospital of this size, 400 and something beds. So there's a lot of, just again, for certain, there has to be a lot of anxiety going on, not just with consumers, but other businesses doing business with this large hospital, right? Of like, are we going to get paid? Are we going to, what about that contract we had for 2 years for IV poles and IV supplies,
Right.
and pharmacy supplies and power, the water, the Pepsi Cola, whatever's in the vending machine, all of that, right? Every single component of the business end of healthcare and in a hospital. I mean, this is a lot of money. So again, you get into like, what's happening with these vendors, and are they going to get paid? Because they're not going into bankruptcy. So they're not going to have any ability to get out from under their actual obligations. So again, with such a rapid closure like this, it's hard to imagine that they're not going to be facing a lot of lawsuits from vendors and other companies doing business with them. And they're not going to be they're still going to have to pay the bill. So it seems like from a business perspective, they're going to end up paying a ton of money out for post-closure for things that they are obligated to pay for, because contractually they're going to be obligated. So I don't see how they're not going to get out of that.
I'm sorry, somebody made the comment of no Pepsi in Atlanta, and they're pretty spot on.
Is that a thing?
I don't drink soda.
So Atlanta is the home of Coca-Cola. It is the major. They have the Coke Museum there. It's a big thing. There's not a whole lot of Pepsi there. Pepsi is far more South Carolina, North Carolina, Florida.
All right. Well, hopefully it was Pepsi.
But you're totally right. Yeah. Everything else you said was spot on, but that, Adrian, was just horribly incorrect, clearly.
And I even remember seeing the Coca-Cola Museum when I was there. Yeah.
Me too.
Yeah. So, but there's got to be a lot of anxiety, and these are things to, I've dealt with closures of the union, with union members and going through these in LA and in other parts of California, parts of Oregon. I've just never, ever seen this happen this fast, because in general, even if you don't give a crap about your employees, these hospitals have contracts with vendors that they just can't. So there's so much about this. It's not making sense. It's not and they're not foreclosing. They're not going under. I mean, I've been in situations where different orders of nuns maybe just kind of folded. They said, hey, we're done with hospitals, so we're going to get out of the hospital business. We're out. We don't have no money. the archdiocese owns everything. That, they had a little bit of a veil to get behind, but they still ended up owing a lot of money and they got sued. Right. I mean, nothing. So I there's something going on here that I'm dying to know what the real background story is, because I just can't imagine, think about all the doctors that they recruit. I mean, I worked for an open heart hospital, the kind of doctors we would recruit on contracts. If they recruited a hospital and usually they'll come in the summer and then, 2 months later, oh, sorry, we're closing. See you later. That doctor would probably have a right to sue. So, I mean, we're talking about surgery groups, ER groups, orthopedic groups. I don't know. I'm baffled. So I'm really dying. I hope a few of you accidentally slide some information into Liz's email.
Drop it in my email. It's a very slippery place.
It's well lubricated
all the time.
Exactly. Smash that like button, you guys too. Smash that like button. For some reason, I can't do comments. I don't know what's going on with my end of things, but I mean, so there's just a lot for people to think about here and a business aspect of this, besides like the human interest component of patients, the reasoning why, the timing. But I also feel like, this is also going to give a bump for, Stacey Abrams in the governor's race. I mean, although there's not really too much you can do to register to vote.
Cal's unsure.
I know the registration to vote thing is so crazy out here. I even have issues in Virginia. I was like, I can't just register to vote. But, I think that again, we have to look at like, who are we electing into office and what are they doing to take care of the public, right? And which parts of the public are they taking care of, right? Are they taking care of the status quo? Are they taking care, and when we come to hospitals, it is a fallacy to believe that because you have money or insurance, if you just don't have enough beds and enough ER, beds, if you don't, there's certain services, if you don't have enough fire stations, if you don't, have certain services, it does not matter how much money you have.
Yeah.
If you're in an emergency, you're not going to make it if you're waiting in line behind 20 other, EMS vehicles. You're not going to get in.
Seems unfathomable that in a city like Atlanta that you would not have that. You know what I mean? Like, and that's kind of the situation it's turning into. Also, hello, Scott. Welcome.
Welcome.
You are late to class, young man.
He had a good excuse.
I have a note from my dentist.
Yeah.
Your appointment was at 2:30.
My appointment was at 9.
Oh, wow.
And we're all jealous of Cal because he's like lounging with a cocktail.
He's just like in Florida, just like chilling.
Yeah, we're just, you're living the life, Cal. So.
Well, this is one of the few weeks that I don't work 60 plus hours, so gotta show off.
No, yeah. That sounds awful. Also, I hope it's not the situation that Christina sent in and said, I've heard from nurses from Atlanta Medical Center that they learned about the closure from the news because
that's awful.
Because what?
That's not unheard of. That is not. We saw that. We saw that in LA.
Exactly what happened.
Yeah. And is there enough capacity at the Wellstar centers to take on those employees? Well, they're kind of spread out. It's not even like you can drive. I mean, it's not like a commute even to these systems because they closed. The other one was, I think, the next closest. That was just recently closed. So, yeah, I find.
And would you want to work somewhere that just did that to you?
Yeah,
I wouldn't. I would be like, "Are you kidding me? Like, what?" And Lakeitha said, I still keep in touch with some of my former coworkers who worked at Wellstar. Some are being relocated or finding a new job.
Finding a new job isn't always as easy as it sounds.
No, especially if you live there. You know what I mean? Your kids are in school. You have a life there. And going back, if you are a Vanessa, that's where you want to work. It's like your trauma center.
I mean, I almost moved to Atlanta. That was my second option, was actually going to Atlanta because they have they had a fairly robust health system and they pay pretty good for the South, overall. But yeah, this is, I don't even know. So 416 beds. I don't know. Has anybody seen the numbers on number of employees? Because I know that's got to be,
it's got to be.
I think it said 900 providers.
It's got to be,
and that's least, just like physicians, nurse practitioners.
It's got to be at least 2,000 nurses.
Yeah,
right. Not to mention ancillary staff.
Yeah, right. Unit clerks.
radiology techs, kitchen staff. I
Pharmacy.
mean,
Yeah.
Orderlies,
Housekeeping.
health,
Yeah.
you know, I mean, EVS. I mean, there's
So you're about 5,000 to 8,000 people or something.
I can whip out a
Mhm.
union contract and show you guys the list of 90 different jobs in a hospital. I mean, it's crazy. So I'm guessing there's somewhere around probably 5,000 employees upwards in this hospital system. Guessing, you know, plus what
I
are the
would guess
properties they
8.
own? What'd you say, Cal? How many do you think?
I would guess probably somewhere around 8,000.
Could be,
so-
yeah. And I don't know if they own the medical buildings where the doctors are at too. I mean, that's
Mhm.
another thing, right? Do they own the medical offices where
Yeah.
the physicians are at?
Probably.
And they're just
Probably.
like, what happens to these folks? They're just going to be next to an abandoned building. You know, I don't know the layout, so maybe somebody who's there knows the layout. I mean, I know our medical offices were attached, so you could just walk right in the hospital. And, you
Yeah.
know, it was kind of creepy when the hospital was closed because the doctors, they were kind of freaked out. They didn't like being there alone.
Yeah, the doctors rent the office space from the hospital, so
And I
And
don't
it's
know
very creepy.
in Georgia, so in California, doctors cannot be employees of hospitals. So I don't know, are doctors employees of hospitals in Georgia? Does anybody know?
It depends.
I don't know for sure, but I know that each physician has to have privileges if they do work in the hospital. So that's like a whole nother thing on if they'll be able to get that privilege to work there, you know, once they do close, and how
Mhm.
long that will that take?
I presume it's a lot like South Carolina, where there is a practice that the hospital filters through and approves everybody, and then the practice hires people from there. But
Oh, okay. Yeah, I don't know. Ahanubon, is that, am I saying it right? Yeah, pretty good for the South, right? So you said 2,800 people, 2019 tax filing. So then we add in like all the temporary employees, right? Probably a few hundred, you know, traveling nurses, temporary techs, contractors, all that. So yeah, I you know, there's a lot. This is going to have a big impact. And I mean, hopefully there aren't traveling nurses who signed up for an assignment there, you know, coming into winter. But yeah, this is going to have a big impact, you know, in the whole immediate area. I mean, small businesses, people buying houses. I mean, the economy. It's a big chunk of change, and this is when you look at the average wages too. I mean, like I was looking at some of the wages at this hospital outside of just nursing, and I mean, they paid. You know, they did pay pretty good. I mean, we're talking average salaries were like $35,000. You know, so for non-clinical, non-licensed staff. So again, the 2,800. Okay, 700 doctors on staff. Okay, right. Doesn't include. So yeah, 2,800 employees, 700 doctors. Yeah.
And it sounds like they contracted out. Who said? Kathy said AMC, dietary, and laundry. So like, so some of the stuff they contract out and aren't actual WS employees. And
that's
Kathy,
pretty standard in the South.
and she had also said that they get 2 months severance if they don't choose to go to a different Wellstar location that is hiring.
if you want a 4-hour commute to work,
Right. I mean,
what kitchen worker can afford that at minimum wage or just above?
Right. Yeah. And these poor contractors, you know, let's not forget there are people that work for these contractors, the kitchen, laundry, wherever, that will be impacted, and they get nothing. They get nothing.
And Kara made a good point of how bad will the payoffers be going out in the various fields when you have an entire hospital shutting down and putting all of those workers out into the water needing employment, because now you can say, well, I'm only going to pay you this because I have 7 other people who could also do that, who are also now very unemployed in this exact situation.
And will work for less because they're hungry.
Yep,
Yeah.
exactly. Which is horrifying.
And then with less pay, they might be traveling further. Gas prices are high. It's just a bad recipe right now.
It doesn't look pretty anyway. You slice it.
No.
Scott, what's your thoughts?
I'm just here to tell everybody it's going to be okay.
How?
I don't know.
Kathy's,
I don't know.
Are you drinking whatever Cal is drinking?
No, I don't think so.
I'm
want that
salty
level
over
of
here in
mad.
pain with my infection in my head. Kathy's saying Wellstar also owns 3 square blocks surrounding the hospital. Oh, right. So, I mean, again, this is prime real estate, right? Very close to the airport.
Kathy, thanks for the deets.
Thank you, Kathy.
But a lot of those
coming.
offices also aren't likely to be closing. A lot of them will probably refer out to other hospitals, get other benefits.
Yeah, I mean, hospitals, when you get a lease, you're signing leases. I mean, doctors sign long leases, not even 3-year. They signed 10, 5-year, 10-year leases. I mean, you're not planning on moving when you, especially if you're in a medical center, you're like, this is forever.
I live here now.
So, right. And so I would just love to hear from some providers also on this, and, some people on the inside about this. So anybody who has any, inside, smash that like button and find some inside intelligence. Send it to Liz. Send it to
If you hit the
Liz.
like button, it tells YouTube that you like other people should watch the video. So thanks for my self-promotion. I appreciate you. Also, Brittany Lauren, thanks for becoming a channel member. I appreciate you. Thanks. Can't words right now.
So I think there's going to be, I just think that this is going to be really developing very quickly, and we'll see in the next week or two really how this rolls out. Because again, I think, we're still in the kind of shock phase the first week of this, but I think as people, again, it's keep in mind, they really were great. They chose like right before the holiday weekend, right? So it's hasn't even been 7 business days. So I think by the end of next week or two, there's going to be a lot more information coming out about this, and a little more feedback, and keep an eye on the op-eds on, your news channels, and really, anybody who finds anything, send it over to Liz, and because this is going to be, there's a lot more to unpack here that we just haven't even seen.
We're going to find out something nefarious is afoot, and it's not going to be pretty.
And the whole point is just trying to get actual information out there. You know what I mean? That is like not overblown, which is why we have a lovely panel of humans, some of who are as angry as me and some who are more like chilled out, like Scott and Cal, who are like, this is going to be fine. Stop being a conspiracy person.
I don't think it's fun.
But you know what I mean?
I really don't
to show a different side. You know what I mean? So the point is just to show the whole situation, and not just my angry, everyone's a villain perspective.
The hospital is at the heart, pardon the pun, at the heart of a community. You need a post office and a fire department and a police department and a grocery store and a hospital. So yeah, this is disruptive, and I don't know enough about it to tell you it's all going to be fine or not, but it has happened before. So people like Adrian who are more familiar can tell you sometimes, yes, one of the local hospitals here, the closest to the one I worked at, was threatening to close. We thought, what are we going to do? We're going to have to absorb all their ER patients. Somebody swooped in and decided they were going to take over and manage the hospital, like Chad said. And so for a couple of years now, it's been under them, but at any minute they could give up on the project, and it could go under again, or a government agency comes in, and so sometimes it's the death knell for that hospital, and sometimes it's a way of getting attention. It's a cry for help, it seems like, and somebody comes in. So you're right, it's way too early to tell what happens here, but hopefully it does impress upon people even that aren't in the field that healthcare is really important, and if it's gone, you're going to miss it.
Yeah.
Well, hopefully it impresses on enough people have seen this and have been exposed to it, that hopefully it's a wake-up call that this thing is not working. We need to fix it. We have got to address this healthcare issue in this country, period.
Yeah.
I'm not in favor of socialized medicine, but we've got to do something different.
Agreed.
Yeah, I'm a huge proponent of universal healthcare. I just think we provide healthcare to all kinds of people, and in other countries, we subsidize healthcare for many other people in other countries, and not even our own people here.
I think that could be a good debate one day.
And yeah, it's so that that's just a fact. And yeah, I think that the other thing, Scott, is that we were talking about earlier is that in California, it takes at least a year to close a hospital. You cannot literally close a hospital in less than a year, and there's a lot of other channels. Whereas in Georgia, it's like, oh, we close tomorrow. See you. Bye.
Good luck.
What else was in play here? So
yeah, I came in on the tail end of that, and which totally makes sense. It's like we were talking about nurses going on strike. You don't just do it the next day.
Yeah.
You have,
Right.
have to give notice so that the sick people can be taken care of. That's what it's supposed to be about.
So it's $15 to $18 for PCTs and CNAs. Is that a good wage?
Okay, so
I saw your comment.
For the South.
Yeah,
it depends. Some of it is based on experience. A lot of times PCTs and CNAs will be starting right out of school somewhere between 12 to 16. But if you have any amount of experience, a lot of times most PCTs and CNAs are looking in the range of $16 to $24 an hour.
Gotcha. Okay. Yeah. Cause I mean, I actually looked in Atlanta and I was looking at jobs. So when I left my job in Ventura, I was making upwards of $60 an hour with charge differential. Never paid for insurance my entire career. Healthcare was all included, great benefits, 12 hours of PTO a month. But I did see, unionization, exactly. But I did see in Atlanta, like, $50 an hour jobs, which is okay. That's reasonable. It's not $32 or $38. I mean, jobs here are $40 an hour where I'm at in Virginia, even though, homes are $800,000.
Make it make sense.
It doesn't make sense at all. So I won't even do it. I'm like, no, sorry, I won't do it. So again, living wage is really important, and not everybody has that ability, to be mobile, to be a traveler, to, people have obligations, kids, they've got different life situations. And, if we don't take care of our health, again, it's like, if you don't take care of roads, right, we could take that position of like, well, everybody's got to take care of the road in front of their house. And then, you're just in sinkholes, or you're in Detroit. I don't know.
We could think of healthcare as kind of human infrastructure.
It is human infrastructure, because if we don't have healthy people,
we got to have the people
workers
to do the work. We got to have the people to do the work, to run the economy, to teach the kids, to, all the other things that we want to do as a society. You got to have people, and you have to have healthy people. And to have healthy people, you're going to have to, either have a really excellent preventative program, which Americans are just loath to do. We'd rather fix a problem after it happens than try to prevent it in the first place. So then we need acute care hospitals and emergency departments and trauma centers.
Yeah.
Maybe it's human infrastructure if we look at it that way.
It's the same thing with teachers, right? I mean, we're just hemorrhaging teachers. It's just like, it didn't come out of nowhere, right? But again, there's, the privatization of education has also had a huge impact there. But I mean, we've got to support these professions and these infrastructure things, because where are we going to be in 10 years? Where are we going to be? Liz has little kids. They need a good education, right? So Mama Nurse Vanessa, you've got kids. I mean, it's like, we need to make sure that we're supporting the health of our children, that a kid who's in a trauma situation, a bus that flips over, you cannot absorb that in one hospital system. We have seen this over and over again. You need multiple hospitals when there is, over 5 people involved in a trauma situation. You cannot, there's only so much that one emergency room can absorb.
I worked at a very high ranking trauma facility here in Florida, and even with one accident, the most that we'll take in is 1 to 2 patients if we can divert those other patients to another trauma facility, because your trauma bay itself, you're doing everything quickly, but you still have to think about the turnover. You got to clean the room to get somebody else in. So you definitely have to have at least 2 level 1 traumas in one particular area.
Yeah. And if you've got a mass casualty situation, I mean, I was part of the emergency response team in my county, although I'm not critical care. Don't want to allude to that at all. I'm not critical care, not ER. But yeah, I mean, unless you got mass casualty and you've got some really good infrastructure for that. But again, in these larger cities, it's just a lot harder to pivot. And so, hopefully, I'm just, really keeping my fingers crossed that the people of Atlanta will kind of rise up on this and force some kind of move and force this hospital to, have some kind of influence to at least have them delay this closure through the winter. Because this is truly just, a complete irresponsible act on their part to close right before winter.
Yeah.
Scott, what do you think?
I think you're right. I mean, panicking has never served me, and I don't think it serves anybody really to panic, but it's urgent. It's let's hope the right people hear this. Let's hope that the people of Atlanta, like you said, hear that and recognize what a threat it is to their overall economy and to their overall quality of life. And, sometimes hard to get people, as we know, excited about healthcare, and like
But here's the other angle too, right? So here's another angle. This is a nonprofit hospital. I was looking at some of their donors, right? And so when you're recruiting donors, right? And nonprofit, even for profit, they have some donors for certain things and foundations. So you're soliciting donations and grants for certain programs. So then, I give to this hospital because my husband Cal was saved at Atlanta Medical Center, and so I'm going to endow $1 million. Well, now they've closed. So what happens to that endowment? Now it's going to go to some other community. I wanted that money to serve this community here in Atlanta. So, little Cals can be saved, right? So,
that depends on how it's written.
Well, right. No, I get that. But just imagine, though, there's all of that at play, right? They're still getting endowments. They're still getting money coming into their foundation, and however their foundation structure is. I didn't have a chance to take a look at that really deep dive, but that's something else to really think about, because this is one of the bigger, if not the biggest hospital they own in this company. I think it's the biggest one. So again, it's like, because it's a nonprofit, they are getting a lot of grants. They're getting a lot of money coming in. So are they going to have to pay that money back? Are they going to have to give money back to donors? These are
Probably
things
not.
And they're going to really piss off a lot of donors. I mean, they're going to piss off a lot of donors with this.
Well, maybe that's another source of pressure on somebody to do something, not just the community, but the donor saying, hey, we've invested, like literally invested money in this hospital, and we're willing to maybe invest again, but we need to be reassured that it's going to, continue to operate. So maybe that's another source 100%. Of pressure.
And this is part of the reason I think it's in large part political posturing.
It's hard to say, though. I mean, there's no ask on the table, right? I mean, I'm a negotiator,
no ask
so I'm always
that we know of.
Like, what's the ask? Like, what's going on behind the scenes? You're right. We don't know what's going on. But I mean, as far as like to have this kind of closure, it's like, we need the whistleblower. We need to hear from the whistleblower. Smash that like button. If you're the whistleblower, email Liz. Just let those documents kind of slide into her email. So we can discuss it, because again, it's just a bizarre situation. It's really confounding to really try and comprehend the timing of this in this short time frame. And there's no ask on the table. There was no like warning. Oh, it's July. Well, we're going to run out of money. We need this money, or we wanted this grant. I haven't seen that. Maybe I'm missing it somewhere.
I couldn't find that either.
I didn't find anything like that either.
It's like that Lord Farquaad thing where he's like, some of you may die, and that is a sacrifice I'm willing to make. Like, that is what this feels like. I'm like, what?
Yeah, it's and we know where that's going to land. It's going to land on people of color. It's going to land on poor people that are uninsured. And that is the reality. This is everybody is not equal in this world, right? And not in this country. So, and there is not equal access to everything in this country, no way, shape, or form. And so, this again is a very important. It's a very important topic, and to be looking at, if any community that you're in, of what is the health of your healthcare community, and we assume that a hospital this big is going to be there forever. It may sell, it would they maybe go up for sale, but why close?
Right.
Yeah. Well, Adrienne, thanks for running this. I appreciate you.
Yes.
Sorry, I didn't mean to be a hog about it.
I really appreciate it, because this was my I looked at that disclosure statement and I was like, I think they have money. This seems sketchy. And that was about where we were. So I'm very appreciative to all of you for coming and offering in your other, I feel like Vanessa with your like critical care thing, like Cal with your
cocktails
that made me angry.
We love you, Cal.
Yes, we do. We need you. We need you. And everyone, that was very, very helpful. And you should go follow all these lovely humans. All their Instagrams, YouTubes, TikTokies are all linked down below, because they have excellent information over there as well. And we're excited if you have any ideas for Mr. Midwife, what he should cover. All the tips.
Hey, the guys, the men, you guys are like wide. You have like anything you can choose. So the guys are wide open in nursing. Let me just tell you,
hey,
the space is there.
The first thing I think of is men during labor and delivery, the dads, the fathers, the brothers, whatever. It's such a women's, not only women, it not only employs women as the nurses, but it's all focused on the woman, the laboring patient. And what about the guys?
and
That's a good
transgender
topic.
people too. I
Mhm.
mean, yeah, you guys have, I mean, maybe some collaboration there, Mr. Midwife and Vanessa. So, you guys are in that same similar wheelhouse, which
Yeah.
I know nothing about. I just go like, I don't know anything, babies, no, glazed over. But there's a lot to know, and that's a huge topic, and just preventative care, right? And the 4th trimester too. Very important stuff you guys can offer. Wide open space. Jump
I
in.
like that. I hadn't heard of that. I like that.
Advice for, I think, getting more confident, like for other people who are nervous about going into clinical, especially if they are guys going into like labor and delivery. Like, what has your experience been like working in L&D and all of that? Like, I think just helpful.
Or advice for OB nurses for when they get students on their floor, and some of them are men.
Yeah. Oh, that's a great idea.
Not to be bitches towards them, and to help them learn and become better nurses.
I don't think there's, and that's, you're right, Scott. There's like, I know that later, like being a union rep, talking to the L&D nurses, they literally were just like, we didn't know what we were allowed to have them do. So like the facilities kind of failed the nurses on that level of precepting. I heard this over and over and over again in OB and L&D from nurses about precepting students, precepting, nurses. They were just like, we didn't know. And then the school, there's just not a good like communication with the schools, the instructor. It's kind of like the instructors may say, well, just go hang out in the corner. And so, that there's something that needs to be bridged there as more
The
men
school
join.
says we don't know what to do with them. The floor says, well, we don't know what to do with them. So let's just make sure they don't, scare any patients and get them through. And yeah, you may have hit the nail on the head. It just needs to be thought about beforehand, and a coordination between the department and having a policy for male students and the school for having a policy and having them work on that. And I don't know, maybe a male midwife could,
I feel a tip sheet coming out. I feel like
Yep.
a tip sheet coming out from somebody in this
And
area.
there's a huge open market on YouTube for just midwifery in general. So like even just excluding coming at it from any angle, there are not a ton of people who provide like educational, non like more straight to the point content that like is helpful. You know what I mean? So like I think that would be very helpful just for like, why did you do this instead of going to be an OBGYN? Why, like, what was the schooling like? What does your schedule look like? Like, you were saying, oh, you have to go deliver babies at 2 a.m. Do you have to usually do call? Are you hired by the hospital, or do you work with a practice who has privileges? Like,
Right.
do you deliver babies on the middle of the street for home birth? Like, you know what I mean? Like in home birth, do you do home birth situation? Like,
how many babies
like
have you
that.
delivered in elevators? I want to know.
Yeah.
A couple.
Do
Really?
you enjoy playing with placentas? Like
You don't exactly play with those, but yeah. Okay, those are good ideas.
Fun fact: in the UK, they don't have L&D nurses. You just
No, they're all midwives.
You specialize in the front end of your education, so you have to choose what you'll specialize in the front end, and they're all midwives. Yeah, that's it.
Wow.
I know, isn't that bonkers?
Yep.
Yeah.
Thanks so much, Liz.
Yeah. Well, thank you. I know. In
Thank
Germany, you just kind of
you.
like call them in when you need them. Like they kind of just like stand off, and then you're like, I think I need help, and they're like, okay, I guess you're probably fine. We don't want to bother you. But yeah, thanks everyone for the discussion. I appreciate you.
Thank you.
Everyone watching, our schedule will be changing in the coming weeks because preschool is happening. Lives are changing. It's not going well. So if you hear screaming, it's Piper. I'm sorry. You might hear her. You might be able to hear her, Adrian. You're probably close enough that you can hear the screams. Everyone in the entire orientation, they were like, is someone dying? I'm like, that's just my child. She was not thrilled at all. But yeah, so we'll be seeing, I'll post an announcement of when it's going to be. As always, like the video, it tells YouTube that you like it. If you want to support the channel, you can become a member, just like or comment or subscribe, interact in some way. YouTube pleases the YouTube gods. Follow these lovely humans, and I will see you next time. Don't forget, you, my dear friends, are more than enough. You are not alone, and you can do hard things. Bye, friends.
Bye.
We have no cute kids giggling to close us out.
It's every color. It's all the colors.
All the